This is going to be a brief recording of McGraw-Hill's Anatomy and Physiology of the Lymphatic System. And we are in week 5 for this chapter. The lymphatic system is made up of several lymph organs and blind-ended vessels that go from every bit of tissue in your body all the way back to your heart. We'll go over everything more than once, and sometimes redundantly, but this system, it's like the venous system without the arteries. It's just toward the heart only. It does return excess fluid from the various tissues in the body. And it's transferring this lymph, it's a clear liquid, sometimes a little milky when it has fat in it. We'll go over that later. But it's just taking all of this clearish liquid toward the heart. You could think of it as a waste management system in your body. And we know already that the blood is filtered in the kidneys, and the blood goes through the lungs and receives oxygen, and the blood goes through the liver and is cleaned there as well. But this is different. This is just a system for taking out the trash, and it's part of your immune system. Here we can see, and it doesn't go larger, so that's fine. You can look at this on your own. Well. You can see usually imaged in green in all different curricula. Green all the way from the farthest in the appendages all the way to the heart. And all the tissues have these lymphatic capillaries. And then just like the venous flow, the capillaries start out smaller and gets larger and larger and larger before it dumps into the heart, into the vena cava, and then the vena cava into the heart. So this fluid leaves the capillaries. It's not reabsorbed by the blood capillaries, it just leaves. Remember that the heart is pumping, and so there is some pressure. This is our blood pressure. There is some pressure that pushes the blood away from the heart. And so some of that fluid from the blood vessels goes into the tissues. The lymphatic system is designed to be able to take that fluid up and bring it back to the heart again. What's in the lymph? Water, dissolved solutes, small amounts of protein, sometimes some cell debris, some pathogens, and cancer cells. It's taking out the trash. They are closed end or blind-ended vessels. They do absorb the interstitial fluid, or the fluid between the cells. Where there are no blood vessels, there will also be no venous, no lymphatic capillaries. So it's not in avascular tissues. That means it's going to be the opposite of what comes up, which is vascular. So tissues with no blood flow. Red marrow in your bones, not in the spleen, and not in the central nervous system, CNS. They're a little bit bigger than blood capillaries. They don't have a basement membrane. We'll have an image of the wall here momentarily, but these endothelial cells overlap a little, and so fluid can come in through those cells. There are anchoring filaments, just like there are with the capillaries for the blood. And this keeps the vessels where they belong, so they don't just spring like a broken rubber band somewhere in the wrong spot. And then you end up with edema because they're, they would be missing. Lacteals. These are also called Peyer's patches. They are the vessels that are in your intestines, the lymphatic vessels. So the lymphatic vessels at your intestines are going to absorb tiny droplets of fat. The fat isn't really digested. It's going to break down. Your stomach has acid, and that helps break up the fat. There's the motility of the intestines. And the lacteals then will absorb the tiny fat droplets, and that'll give the lymphatic fluid a bit of a milky color. Here we can see a larger image of this opening that's in a lymphatic vessel. You see it is closed at the end. It's only going toward the heart. And these dots within these forms represent cells. These are the anchoring filaments in pink to hold this capillary, this lymphatic capillary in place. You can see right here, there are openings that come, you get out together, something like this, okay? So when the lymph moves this way, they flip back shut. The lymph can't go back away from the heart. It can only go toward the heart and not back, similar to veins. Hydro, water. Pressure, hydrostatic pressure of the interstitial fluid between the cells fluid pushes this fluid into the capillaries. This doesn't happen so well when you're just laying in bed all day or sitting at an office desk all day. The pressure of the lymph in the vessel is going to force the intercellular openings, or those flaps of the capillary wall, to close with the lymph inside. And the lymph moves through the vessels of larger and larger sizes until it enters the circulation at the vena cava, right at the heart. The pathway, the lymphatic capillaries are the smallest, and then lymphatic vessels, lymphatic trunks, and lymphatic ducts. And this is part of your immune system, a large part. Getting rid of cellular debris, cancer cells, pathogens that are just in the tissues. Sometimes, well, everyone's body has some cancerous cells. And when these cells take hold and they start multiplying in the body, if they can be cancerous or not cancerous. And the tumors are uncontrolled cell growth, and so are cancers. The metastasis is when it moves. So if these cells that made a community here and they're proliferating, if some of those go off into the lymphatic system and somehow lodge somewhere else, or in some situations, even the circulatory system, then that's called metastasizing. It's moved from one area to another area. Okay. Takes up residence in both, now more than one area, it's called metastasis. And depending on how many areas the cancer has set up shop and started proliferating, that's going to determine the level of cancer type 1, 2, 3, 4. You've heard of those. Cancers break free from the primary tumor and move around in the lymph. Normally, it's better for the cancer cells to get in the lymph and go get filtered out. But in a person that's compromised, and for some reason the cancer has set up shop or the tumor has set up shop, and it's actually become, it's just set in, then that's not a good sign. Lymphatic vessels, they are led by the lymphatic capillaries. Okay, remember, smaller to larger to the heart. There are 3 vessel layers. They're called tunics. There's the intima, and intimately, it's the inside. Intima, the media in the middle, and the externa on the external part, the outside of the vessel. They have valves to prevent pooling and backflow, like we talked about before. The lymphatic system does not have a pump. The heart is not going to, that doesn't pump. It has nothing like that. So again, it's like the veins are, they have the one-way valves. The pulsatile movement of blood in nearby arteries. So think about a garden hose that has a little more in it every bit, or as the heart pumps, the arteries may expand just a little, and this is going to press a bit on the vessel, the lymphatic vessel, which is going to squeeze it. Everything in the body goes the path of least resistance. So when this vessel is squeezed, the lymph pressure goes up. It's higher pressure because it got squeezed from the artery pulsing. Squeezes, and the lymph has to go up toward the heart because of those one-way valves. When it goes up toward the heart, it can't come back. Contractions of smooth muscle in the larger lymph vessel walls. That helps. Some vessels connect to lymph nodes for filtration. There'll be a picture about 3 slides from now. But these lymph nodes look like kidney beans, and the internal structure is a little bit like a human kidney. And they're there to filter. Lymphatic trunks are fed by lymphatic vessels, right? Jugular trunks drain lymph from the head and neck. Okay. Subclavian, clavicle, subclavian trunks drain upper limbs, breasts, and the superficial thoracic wall, all around the thoracic wall. Bronchomediastinal trunks drain deep thoracic structures. And we have intestinal trunks and lumbar trunks. You can go through this again on your own if you want to be more specific or more in-depth. The lymphatic ducts are the largest, and they bring the lymph to the blood circulation. There are 2. There's the right lymphatic duct and the thoracic duct. And it seems so very unfair, like the rest of life. One seems to be doing so much more work than the other. The right lymphatic duct, it's near the right clavicle, and it drains the upper right quadrant of the body. Delivers the lymph to the junction, right subclavian and right internal jugular veins. So right up close to where, right in here. Okay. And here you can see the right lymphatic duct is servicing this area, not even a quarter, not even a third of the body. And then the thoracic duct is the largest lymphatic vessel, and it's going to run from the diaphragm directly under the lungs to the junction of the left subclavian and right jugular veins. And you can memorize that if you like. Easy way to do that would be to sketch it on a paper. And after you sketch it, just kind of go over it a few times. It's a great way to learn it if you want to remember them all. Sac-like cisterna chyli is lipid-rich chyli from the GI tract. This is going to be from the lacteals or the pyre patches. Drains lymph from the left side of the head and neck, upper, all of this. Okay. And we'll learn a little bit more how that works as we go. This is a very short chapter. Here you can see those vessels that we're talking about. And here, cisterna chyli. It's like a cistern, like a holding area, like a cistern. Okay. Interstitial fluid, if it doesn't get into the lymphatic vessels and move on, then it's called lymphedema or edema. And that is not going to be comfortable. It's going to cause swelling, of course, because that fluid can't leave. And it may be painful. It will interfere with wound healing. It'll contribute to infection because all of the trash isn't being taken out. It's as though we decided, okay, we're not going to run city trash service. Just throw that trash somewhere in a closet. And the body can't handle it any more than our house could. Most of this blockage is caused by trauma or tumors, radiation therapy, scarring, surgical removing of lymph nodes. Back in the day, way back in the day, when a woman needed a breast removed, they would take the breast and all of these axillary lymph nodes also, because the lymph nodes are the filters and that's what's holding up the, cleaning up the trash out of the body. One method, there are more. But then the woman is left with this entire arm being unable to drain properly. And so a woman would have one normal arm that she would use and another arm that's very uncomfortable and very much enlarged from this fluid buildup. Okay. Some people control the lymphedema, like around the ankles, with compression garments, like compression hose sometimes that people wear if they're on their feet a lot throughout the day. Exercise helps, massage helps. If you're doing a lymphatic massage, you should put about 4 ounces pressure toward the heart. 4 ounces pressure toward the heart. There's no need to be doing some deep Swedish massage here. It's going to cause pain. 4 ounces toward the heart. This can be done post-surgery to help the body clean up from what's happened through surgery. And it can be done for someone who's compromised in any way. You want to drink a lot of water if you do that, because think of a trash storm everywhere. So your body all of a sudden, oh, we're all this trash, and we've got to clean it all up. And you think, okay, it's going to go through the blood. Okay. Lymphatic vessels, heart, through the blood to the kidneys. We need to drink a lot more water because this stirs up more than what it seems like. If you think, oh, it's just 4 ounce pressure toward the heart, that's no big deal. It's going to do a whole lot. And if you don't take care, you'll feel like you have a good case of the flu the next day. In extreme cases, and you might have seen someone with a massive foot, a massive leg, one or both. And extreme cases are known as elephantiasis. Elephantiasis caused by infection with parasitic worms. Helminths. Worms, helminths. There are ways to maintain the body so that you don't get worms. If you do get worms, you want to be gentle with the killing off of them. Gentle with the killing off of them. You want to get medical help. If you have a severe case of helminths or worms and or some other parasites, and you kill them all off all at once, this could have dire consequences. So you want to have some help by someone who knows what they're doing, and they've been working on this before. They've helped people get rid of these parasites. In the 1950s, you could buy a diet capsule, and what was in that diet capsule was a tapeworm. Yeah, times change. Maybe they get better and maybe they just change. Primary lymphoid structures. Yeah, these are involved in the formation and maturation of lymphocytes. The red bone marrow and the thymus. Yes, the thymus is involved in formation and maturation of lymphocytes. Mentioned that twice for a good reason. Secondary lymphoid structures. They don't make lymphocytes, but they just hold them, and other immune cells. These are sites of immune response initiation. They're starting the immune response. These include the lymph nodes, spleen, tonsils, and lymphatic nodules. You want to remember the term MALT, M-A-L-T. You want to remember that. It's mucosa-associated lymphoid tissue. Mucosa-associated lymphoid tissue. The red bone marrow is between the trabeculae of the spongy bone. So you're going to find this at the ends of, say, the femur and the long bones, several other places. Here we have it. In flat bones of the skull, ribs, sternum, vertebrae, ossicoccae, heads of the humerus and femur. The humerus, that's where your funny bone is, the humerus, okay? Site of hematopoiesis, production of blood's formed elements. Hema, blood, hematopoiesis. If you learn the terms, the word parts, then you can see a test question you've never heard of before. Put all those word parts together and you'll know it. And it's not cheating. Formed elements include T lymphocytes and B lymphocytes. The T lymphocytes migrate to the thymus to complete maturation. That's important to remember as well. Formed elements of hematopoiesis. A lot of these are white blood cells. There are several kinds, and if I enlarge it, it's going to go away like it did before. So I'll just leave it the way it is. And there's a red blood cell there. Red blood cells get smaller and smaller as they age. They live for about 120 days. The white blood cells are especially good with fighting infection. And here you see a circuit with the thymus and the red bone marrow. Yellow bone marrow, it doesn't work anymore. It's fatty. So it's not doing this job. The red bone marrow does this job. The red works and the yellow has become fatty. The thymus is involved in T lymphocyte maturation. It's in the mediastinum or mediastinum, depending on where you're from, potato, potato. It's larger in children than adults. This part of the body gets smaller and smaller with age. It changes from this gland, it changes to fat adipose tissue. It grows until puberty, then regresses and is replaced by adipose tissue. There are 2 thymic lobes, and each are surrounded by a connective tissue capsule. Trabeculae here and there all over the body. So we heard about the trabeculae in the bone and the osseous tissue. This is trabeculae, just that spongy pattern that it's formed in. Trabeculae capsules are they subdivide the lobes into lobules. Each lobule has an outer cortex and inner medulla. This is not the only thing that's designed that way in the body. Think of the adrenal glands that are on top of the kidneys, retroperitoneal, like little ice cream scoops on there. And they have the same cortex on the outside and the medulla on the inside. Both of these regions are lymphoepithelial. They contain lymphatic cells and epithelial tissue, both. The cortex contains immature T lymphocytes and the medulla contains the mature T lymphocytes. Here you can see where the thymus is, so big on a baby, quite large. And you can see this tiny little thyroid. And then the parathyroids are going to be like little dots on the back. People have 4, some people have 5 parathyroids on the back of the thyroid. And here's the thymus that we're looking at, quite large, tiny little heart for this little one. And for the older person, the adult, the thymus has turned to fat and become so small, it's about the size of a normal thyroid. And in relation to the heart again, yeah, quite a change. Okay, secondary lymphoid structures. They do house the lymphocytes and other immature cells within a reticular connective tissue matrix. Everything's anchored in place in the body. When it's not, there's something wrong. Organized into lymphoid organs, aggregates of lymphoid nodules. It seems very simple, but the job is so important. The organs have a complete capsule of dense, irregular connective tissue. These are the spleen and the lymph nodes. You might be asked at some point, what's the largest lymphatic organ? Other lymphoid structures have an incomplete capsule, or they lack one, and this will be the tonsils. Know that you have 3 sets of tonsils, and you need to be able to label the 3 sets of tonsils. MALT, M-A-L-T, that we mentioned earlier, and diffuse lymphoid nodules. Yeah. Lymph nodes, they do filter the lymph. Again, they remove everything that's unwanted if they're doing their job. They're small, oval, they look like kidney beans. They're along deep and superficial pathways of lymph vessels, and they're in little groups, like they come in clusters, and they receive lymph from certain regions. Cervical lymph nodes receive lymph from the head and neck. Cervix means neck, and we have 7 cervical vertebrae because those are the ones in our neck. And a cervical lymph node is going to be one for the neck or in the neck. Axillary arm, axillary lymph nodes receive lymph from the breast, axilla, and upper limb, the whole arm. Inguinal lymph nodes in the groin receive lymph from the lower limbs and the pelvis. So we have a good filtration system throughout. Okay, so here is a great image of that kidney bean shaped lymph node. And it's a little bit like an actual kidney in here. You have afferent and efferent vessels. Afferent vessels going into the lymph node and efferent out of the lymph node. This is the hilum, this inside indentation where the vessel goes. The cortex does have lymphoid nodules, and there's some very, very detailed information about the lymph node there. If you're interested, microscopic scan, microscopic image of the lymph node. Medullary sinuses, you want to remember always, what is a sinus? A sinus is an open area. Okay. And these tiny open areas, they are lined with macrophages. That's a hungry cell. Macros, large, phage is hungry. And so they are going to, those macrophages are going to clean up. They're going to eat debris because they're always hungry and always needing to eat more. Lymph flow enters through several afferent vessels. Macrophages are going to remove foreign debris from the lymph. Lymphocytes might initiate an immune response. The lymphocytes can proliferate, especially in germinal centers, and can cause enlarged nodes that can be palpated in the neck and axilla. Lymph exits through the efferent vessel. Lymphoma, it's cancerous. Lymphoma. Malignant means it's cancerous. It's a neoplasm from lymphoid structures. It's not tender, but it is enlarged. This might cause night sweats, fever, and weight loss. Hodgkin lymphoma. It affects young adults, people who are younger, and people over 60. If you catch it early, it can be cured by excision. Cut it out, radiate it, irradiate it, and chemotherapy. It would be good to do a little bit of research on chemotherapy and see what percentage of the time it helps, and if there are side effects that you want to be aware of. Non-Hodgkin lymphoma is more common. Some kinds are aggressive and others are slower growing. The spleen is the largest lymphoid organ. It's in the upper left abdominal quadrant. It's lateral to the left kidney, and posterior lateral to the stomach. Posterior lateral aspect is convex and rounded, and the anterior medial border is concave. The hilum is that indentation that we looked at earlier. The splenic artery supplies blood, and the splenic vein drains it. There's a connective tissue capsule, trabeculae. From the capsule extends into the spleen, dividing red and white pulp. White pulp, clusters of T and B lymphocytes and macrophages around a central artery. Red pulp contains erythrocytes, maybe that's why it's red. Erythrocytes, platelets, macrophages, and B lymphocytes. The splenic cords are cells and reticular connective tissue. In the red pulp, the splenic sinusoids are very permeable capillaries. This is a storage site for erythrocytes and platelets. And that storage of erythrocytes, red blood cells, is why it's red pulp. The spleen monitors blood as it flows through, filters and monitors blood, not lymph, in the spleen. White pulp is monitoring for foreign materials, bacteria. Macrophages, again, are doing their work, phagocytizing bacteria, debris, defective erythrocytes, and platelets. So the path that flows in this splenic artery, central artery, sinusoids, venules, and then the splenic vein. And again, it eats foreign particles, clears defective erythrocytes and platelets, and stores erythrocytes and platelets. In the first 5 months of fetal life, The spleen makes blood cells, can be reactivated under certain conditions. Some hematologic disorders, extramedullary hematopoiesis is what that's called. Fetal life is, we're learning more and more about. And we're finding that the mother, even in her brain, will hold cells of her offspring decades after birth. She still has cells of her offspring in her. And of course, vice versa. Surgical removal of the spleen is a splenectomy. Maybe it's ruptured from an abdominal injury, like a car accident. Maybe infection has just become so severe, there's no clearing the infection out anymore. From cysts or tumors, lymphoma or other cancer, or blood disorders like sickle cell anemia. And then this person might be more prone to a life-threatening infection. There are no vestigial organs in the body. We have removed parts of people's bodies, and then you know, their health is somewhat compromised, whether they notice or not, even if it's the appendix, that little finger-like projection from the intestine, and it holds the ancient bacteria so that the gut can be reseeded after a terrible illness or after a strong broad spectrum antibiotic course. That ancient bacteria from the appendix can come back and reseed the intestine. So it has great value. There are times when tonsils or an appendix or something has to be removed, but not as often as people used to think. You know, we can cut that out, and then they did. There are 3 sets of tonsils in this image. I would highly recommend you remember which ones are where. Pharyngeal tonsil, way up here. Palatine tonsil, then next, and then the lowest is the lingual tonsil. Lingual, linguistic, lingual, tongue, okay? So right on the back of the tongue is the lingual tonsil. Up higher, palatine, and then the highest is the pharyngeal tonsil. The immune surveillance of inhaled and ingested substances is what these tonsils do. They do have invaginations that trap material, and you can see, can't see them very well here. You can see where there are these invaginations. They contain lymphoid nodules with some germinal centers. We're almost at the end, so it's been a kind of a long stretch without stopping and talking about donuts or puppies or something, but 3 slides and we'll be finished. Acute tonsillitis, inflammation, infection. Palatine tonsils are the most commonly affected. They redden, they enlarge, and they may partially obstruct the pharynx. This person may experience fever, chills, sore throat, difficulty swallowing, and they might be infected by viruses or bacteria. So if a person has viruses infecting the tonsils, will an antibiotic help? No. And vice versa. If you have bacteria and you're taking an antiviral, that's not going to work well either. A tonsillectomy could be required for persistent reoccurring chronic tonsillitis, but that tonsillectomy might be required if, and this is what happened with daughter number 3, if the tonsils, when they partly obstructed the pharynx, they completely occluded the whole airway. So she went into convulsions. She passed out, no oxygen, and it did have to have her tonsils taken out. So always have more than one child. They can help each other. Lymphoid nodules. They are not completely surrounded by the connective tissue capsule. They're scattered nodules, and they're termed diffuse lymphoid tissue. They're found in every body organ because every organ needs the trash taken out. They help defend against infection. They group together to form larger structures like the MALT, M-A-L-T. Then lastly, the mucus-associated lymphoid tissue is located in the GI, respiratory, genital, and urinary tracts. Think of the tissues that are in each of those areas. It will make more sense. These are found in lamina propria of the mucosa, and they do help defend against foreign substances that might come in. Prominent in small intestines, especially the ileum, are pyre patches, like lacteals, pyre patches. Large collections of lymphoid tissue in the wall of the GI tract, and they do absorb those tiny droplets of fat that have been broken down into smaller and smaller droplets. Well, this is what McGraw-Hill has for us for our lymphoid chapter. It's not given the time that it deserves. It's such an important part of the body. It's necessary. Think if you don't have that lymphatic drainage, the trash stays and infection is probably imminent. The person who sits on a plane for 12 hours or 6 hours, especially if they're elderly, they may have edema or lymphedema around their ankles or lower legs. This is when a person needs to get up and move around. Just like the pulsing of the arteries next to the lymphoid vessels pushing and helping, so does walking and moving, because every time we move a muscle, the muscle expands a little bit, pushes on that lymphatic vessel and pushes more lymph toward the heart. So think of the difference between just being still on a plane or a bus and walking. So walking, moving your arms while you're walking, that'll help keep the body's tissues fresh, and drinking plenty of water so that this trash can be taken out and the body can clean it up. If you have questions, please put them below. I'd appreciate reading them and being able to answer them. And I guess this does it for our lymphoid chapter.